Before we get started with the presentation today, a little housekeeping. I'm going to ask that you all hold questions to the end of today's presentation, or feel free to enter them in the chat. I have a few community relation colleagues on the line who will capture those questions and address them later on. And also, I don't know if Cynthia has joined us.
Hey, I'm here.
Okay, perfect. We actually are joined by Cynthia Bradford, who is the Community Relations Manager, and I will ping it to her for a little background on our department.
Great. Thank you, Nick. Welcome, everybody. I'm Cynthia Bradford. Some of you probably recall me more so Cynthia Allen. I remarried about 3 years ago, so I still sometimes people go by both names. So I'm still going through that. But anyway, excited to meet you guys today. We do have new members of our team. We wanted to update you guys that we've had some recent staff changes as well. For those of you that probably have worked with Scott for many years, Scott Fountain, he retired in June. And so now our vice president is Keith Norman, Dr. Keith Norman, who many of you probably already know in the community, who's well engaged and quite a leader in our community already. And so we're excited to have him on board with the Baptist team. He's now heading up government relations and community relations. We also have on our team, those of you have met, probably Anne-Marie Wallace, who oversees all of our health fairs and kind of health initiatives. Primarily, her main responsibility is also overseeing our medical clinic, which is our signature program providing free health care for the homeless. Few people know that we do that 4 days a week in partnership with Christ Community Health Services. And then also we've got Caitlin Hayden, who is also one of our new, well, she's been on, probably 7 years now. We, about maybe 6, 7 years ago, I guess, merged with the healthcare system, Mississippi Baptist in Jackson, Mississippi. And some of you may be familiar with that. It was a really beneficial, I guess, mutually beneficial merger acquisition between two healthcare systems, making us, be able to bring even better services to you all and to our communities. Caitlin Hayden was with the original team there and has now onboarded with our group. So she's still based in Jackson, Mississippi, but serves the center. She actually oversees all the Central Mississippi market in terms of outreach and community engagement. Also in the Jackson area with her is Abby Brand, who you guys are seeing helping Nick out today. Abby Brand also has joined our team probably, well, it was really interesting. She and Nick both joined about the same time during the pandemic. And so if anybody's on board, any new team members during the pandemic, it was weird that most of your team members, you hadn't seen them in person until like a year later. You did the interview and everything virtual, but they have really been amazing, both Abby and Nick, to come on board. So Abby, for those of you who've worked with our wellness initiatives like our Renew diabetes prevention program, our diabetes camp for kids, Camp Day to Day, programs like that. Abby's overseeing those and working with our Baptist medical group, our primary care physicians group, where we get a number of referrals for patients. So if there are services that extend beyond the scope of what we offer in our primary care clinics or our hospital settings, whether it's people want to lose weight, to prepare for bariatric surgery, or if they have other goals, they just want to maintain a healthy lifestyle and, adopt some healthy behavior. So Abby's overseeing those. And of course, Nick, you guys are starting to really get to know him. I've tried to take a step back and really allow him to work with the organizations, as he'll be kind of your new contact as it relates to reaching out about sponsorships and, you know, um, charitable partnerships. He'll talk a little bit more about that, our desire to focus more on partnerships, and most of you are probably familiar with that. It adds more value to what we can bring to the communities and how we want to invest our dollars, so that we know how those funds are directed. And then also there have been changes in recent, well, I wouldn't say recent years, probably in the last 10 years or so, and some of you are familiar with that as well. The community health needs assessment is not something new, but it is kind of our guiding star, if you would say, as to how we want to direct our giving. so that things align and they support initiatives as a healthcare organization that we are trying to help reduce, obesity or heart disease, diabetes, and things like that in our community, be able to better serve, cancer patients and so forth. So if you've got programs, and sometimes we have to get a little creative, and Nick will kind of talk about some of those examples where some of your programs may not necessarily, health is probably not the focus of what you do for your organization, but there's always opportunities sometimes to kind of explore solutions around that. So I think I've probably long enough. And Nick, I'll turn it back to you.
Yeah, thank you, Cynthia. I just want to note, although I am the grant and sponsorship contact for most of our region, for Central Mississippi and North Mississippi, Caitlin Hayden will continue to be your point of contact for all things sponsorship and grant making related. All right. So Baptist Memorial Healthcare is noted as one of the country's largest not-for-profit healthcare systems. We're composed of Baptist Health Sciences University, which is our education institution, and also 22 hospitals located between Tennessee, Mississippi, and Arkansas. Our mission is in keeping with the threefold ministry of Christ: healing, preaching, and teaching. Baptist Memorial Healthcare is committed to providing quality healthcare. This next slide is just a depiction of where our hospitals are actually located in the service counties that we cover currently. It also breaks our region down a little bit more. So we are based in Memphis Metro, Northeast Arkansas, West Tennessee, North Mississippi, and Central Mississippi. We also welcome sponsorship and grant requests from any of our service areas, and also any place or any organizations that are essentially located near our hospitals as well. And I do want to take the time for those who are joining us. We have asked you all to hold all questions to the end of today's presentation, or feel free to enter your question into the chat where my colleagues will be able to grab your questions and we can address them later on in today's conversation. The Community Health Needs Assessment, or the CHNA, which Cynthia mentioned earlier, is an intensive research process that gathers key health data from our service areas. Baptist uses the results from that assessment to guide community initiatives, engage appropriate partners, and address community needs. The primary goal of the CHNA, or the Community Health Needs Assessment, is to provide a base measure of key health indicators, establish benchmark and monitor health trends, guide community benefit and community health improvement activities, provide a platform for collaboration among community groups. We love to see synergies amongst our organizations that we support. Serve as a resource for individuals and agencies to identify the community health needs assessment. So I want to kind of pause right there. The Community Health Needs Assessment is a public document. So although it helps guide our funding priorities here at Baptist, it is something that is centrally located on our website. And I'll touch on where that can be found a little later in the presentation. But this is a wealth of knowledge as it relates to health disparities in our service areas, and it's available to the public. So please feel free to use this public data for your various needs. And last but not least, the CHNA also helps us to provide community benefit initiatives while maintaining regulations with the IRS. So outside of our external community partnerships and programs, Baptist also operates 3 internal outreach programs known as Baptist Operation Outreach, Baptist Healthy Communities, and Baptist U Health Corps. Baptist Operation Outreach is our signature program in partnership with Christ Community Health Services, and it provides healthcare resources and support to the homeless community. The clinic averages 3,000 patients yearly. Then we have our Baptist Healthy Communities program. It provides healthcare resources to church congregations, faith-based programs, and other community groups that have a vested interest. Oh, I don't know what happened to, give me 1 second, guys. There we go. Can you all see my screen? I can't see you guys, so just throw up a thumbs sign.
Okay.
Okay,
You're good.
perfect. Thanks, Cynthia. So Baptist Healthy Communities, it serves the church congregation, faith-based programs, and other community groups with a vested interest in achieving a healthier community. Baptist U Health Corps is in collaboration with Baptist Health Sciences University, and it houses two of our career exploration programs, Black Men in White Coats, which is actually happening this Saturday, and we're very happy to have this particular program in person again, as last year we had to transition to a virtual platform. So our Black Men in White Coats event happening this Saturday. And I'll be sure to follow up with the information after this conversation. And I think we may be able to even put some details and maybe the registration link in the chat today. And She Leads the Way programs, which is another one of our career exploration programs for ladies and young women. So our funding priorities come directly from our community health needs assessment and are subject to change every 3 years. Our current funding priorities come from our 2019 community health needs assessment, and they currently are chronic disease and healthy living, cancer, women and maternal child health, mental health, and other community programs. A little bit about our grant cycle timeline. So annually, our portal opens January 1st and concludes May 31st of each year. We have our internal grant review meeting in July, and grant decisions are made and announced after October 1. So here at Baptist, our grant cycle actually runs October 1 through September 30th. And we normally ask grant seekers to submit a year prior to the need of their financial request. So for instance, if your programmatic event or has a start date of in calendar year 2023, we ask that you submit now in 2022. So again, that if you have any initiatives, any and all initiatives happening in 2023, we're asking for you to submit your proposal in 2022 between January 1 and May 31st. And we understand that it may be hard to kind of submit programming and kind of event initiatives a year in advance. So if you do miss a deadline or need a little bit of wiggle room, please work with me directly. So we kind of talked about the how and the when. Let's talk about the where. So where can you actually access our funding applications and the community health needs assessment that I touched on earlier? So you can visit baptistonline.org, and all these tabs here at the top would be visible to you once you visit baptistonline.org. You can select About Us. From the About Us page, you'll select Community Involvement, and then it'll bring you to our Community Involvement Outreach page. You then can select Charitable Giving Guidelines, and it'll take you to our landing page where our funding applications live. And you can also select the hyperlink Community Health Needs Assessment and view our most current CHNA. So after you select charitable contributions, it's a hyperlink that'll take you to the page you see now. You can scroll down on this page to see the rest of our funding applications, and you can select the hyperlink Apply Now if you're looking to apply for a charitable contribution. And scrolling down, you can see our in-kind contribution hyperlink as well, submitted online. So after selecting the hyperlink, it'll take you to our portal homepage, and you can see all of our current funding applications on the homepage. And there's a small brief description of what applications we typically accept through each one of our funding applications on this page. So to kind of get into what funding applications, what they look like and what we accept, the Baptist Healthy Communities application, we normally accept health fairs through this particular link. We see a lot of church congregations and faith-based agencies submit through Baptist Healthy Communities. And all we ask for Baptist Healthy Community applications is something we accept all year round. We just ask that you give us a buffer of 6 to 8 weeks prior to the start of your event or program. With sponsorships, this is typically where you see your golf tournaments, your fundraisers, and your health-related walks. We accept sponsorships January 1 through May 31st of each and every year. Cynthia kind of alluded to this earlier. Even though we do grant sponsorships, the pool for funding is being allocated more to programmatic initiatives. As Cynthia mentioned earlier, we really want to see the impact through programming that's happening. And just to kind of give an example, we've had people organizations submit to us and for small $5,000 sponsorships for galas here and there that we would decline. They would submit every year and be declined. So it took the community relations team to kind of really sit down with the organization and understand some of the programmatic needs of the organization. And we discovered they had a huge health program that they were undertaking. So that was of interest to Baptist. So once that organization submitted the programmatic need, they were supported way more than the $5,000 they were submitting for. We were able to actually support them at, I think, at $20,000 versus the $5,000 for the gala. So just kind of think about that for a minute as well when you think about applying for, I know galas and events are normally a big fundraiser for a lot of organizations, but we really want to see our dollars contribute to the community. And it can actually yield a higher funding opportunity for our organizations if we were to submit a programmatic need versus an event or a sponsorship request. Charitable contribution is where, moving right along, is where you will see some of the programmatic initiatives submitted through. Again, annually opens January 1 through May 31st. And we typically ask for requests to align with our CHNA strategic implementation plans with this one. In-kind gifts can be accepted year-round. Only thing we ask is for an 8-week buffer to make sure that we have the internal services to provide. And I'll go ahead and ask, can everyone, as you enter, go ahead and mute your mic. This next page, frequently asked questions. I'm not going to spend too much time going through each one of the questions, but I do want to highlight some of the more hot topic questions. One of which being, what is your range of giving? It truly depends, and it's based on the need and the program budget. We do ask that each and every grant seeker submit an itemized program-specific budget with your proposal. And keep in mind, like even though we are a charitable giving organization, we don't have the budget of an international paper or a FedEx. So it really just depends on the current need and the program budget. So please be sure to submit an itemized budget with each one of your proposals. This has kind of been trickled throughout the whole presentation today, but our initiatives that we currently support based off our 2019 Community Health Needs Assessment is chronic disease, healthy living, women and maternal child health, cancer, and mental health. Another question I want to kind of key in on, does Baptist funding priorities change? Yes. Our funding priorities are subject to change every 3 years as we undergo the CHNA process, which happens every 3 years. Number 5, do we award multi-year grants? We currently do not award multi-year grants, and we ask that all of our grant seekers submit a formal request each and every year. The reason being is simply because we don't know our budget year to year, and would hate to make a commitment and have to pull out or be unable to support a year. So we ask that you submit a request each and every year. And the last one I'll touch on is, do we require an impact report? Starting this May, we definitely will require an impact report. It's one of the new initiatives that we're trying to push with our community partners. It'll be a really low maintenance, probably 6 to 7 questions that our past grant seekers will receive this May. So if you received the grant from us last fiscal year, please be on the lookout for an email from me with the impact report. Again, really low maintenance, 6 to 7 questions.
And if I could just add something there, Nick.
Yeah.
On this page on the site. So as it relates to our CHNA, our core focus within all those areas is providing access to underserved populations. So if your programs or your organization is reaching communities, BIPOC communities, you're serving underrepresented, communities and providing access to care, also building equity. Those are the types of initiatives that are most of interest to us that we're seeking to support. So I thought that'd be helpful for them to be aware of. And our community health needs assessment for 2022 should be completed by the end of our fiscal year. That's the IRS requirement, federal government requirements. And so it'll be posted on our website, because right now, if you go to the site now for our CHNA, you'll see 2019, which is the most recent. But on October 1, you'll see 2022.
Perfect. Thank you, Cynthia, for that.
Welcome.
And last but not least, this is our
I'm sorry, Nick. One more thing on the CHNA.
Yeah, please.
I don't know if you mentioned or not. When you guys go to the CHNA webpage, you'll notice that the reports are broken down in 5 regions. So it's Memphis Metro, Central Mississippi. There'll be Northeast Arkansas, and there's also West Tennessee, and I can't remember the other area, but it's 5 different regions. And then at the bottom on the right-hand side, usually you'll see a strategic implementation strategy plan for each of the hospitals. So those are entity specific. And so if you're in the, let's say, Memphis Metro area, you might really want to look at the report that gives you all the content, the data that's useful in any of your planning, and certainly any of the not-for-profit hospitals in our areas or any, across the country you can look at. So here, St. Jude would have it, Regional 1, Methodist, as well as ours. So that's a resource that I would encourage you, Nick touched on earlier, but I would encourage you guys to kind of look at it, kind of see what those needs are, and if there are, ways that your organization can serve or make an impact in those areas. The strategic implementation strategies are kind of what we'll evaluate each year with all the hospitals. We typically submit a community benefit report. And when you guys, when we're working with organizations like you and the programs that we support, are specific, that we're targeting this, not mean it's measurable outcomes. We can just, definitively say our dollars were invested to make this sort of an impact, this sort of difference, and then it's measurable that we can report annually with our 990 and our Schedule H. So that's really important to us, and 100% of what we give can be counted. Whereas if we were supporting a dinner or a golf tournament, only a percentage of that could count as 100%. So for those of you who will have some events, there are a few events we do support because we like to be, good neighbors in our community. If there are some of you who do have events, you'll be asked on the sponsorship proposal to kind of specify what percentage of that is tax deductible. So please make sure you complete that and consider that as you're completing the assessment, the proposal. And if anytime you have any technical difficulties, it would help us if you first click on the need support link at the bottom of the page. And if you're not able to resolve your matter with the vendor, cyber grants, then reach out for sure to Nick or myself. We'll be happy to help.
Yeah, perfect, Cynthia. Thank you for that. Yes, any technical issues that you're unable to resolve with the help option, please, again, I just echo Cynthia, please feel free to reach out to myself or Cynthia. This last slide is a depiction of our amazing, hardworking team, the community relations team. We have Dr. Keith Norman, Mary Freeman, Cynthia Bradford, Caitlin Hayden, Abby Grant, and Emery Wallace, and myself. I've included our community relations email address at the bottom, and my direct contact for my email address is under my little picture there. So if you have any questions or any grievances, please feel free to reach out to me directly. At this time, we would like to open the floor for any questions that you guys may have, and also maybe address some of the questions you may have entered into the chat. So if you feel free to come off mute and ask your question to me directly, or put it in the chat, whichever you're comfortable with.
And Nick, while they're coming off mute, I only saw one question that was in the chat, and it was from Donna asking if we could get clarity around submitting a grant for the period that closes May 31st. In essence, are we asking you all to submit for events in advance that occur in 2023? And I think I answered that question to make sure that she and others were aware that, yes, you would be submitting for any events that occur between our fiscal year, October 1 through September 30th of 2023. And then as Nick said, sometimes it may be difficult. There are some organizations that do some of the same events or programs year to year. We do try to, build relationships with folks. And so we kind of know what some of those needs will be and want to better anticipate those. But it helps us kind of plan out for our budget year. So like Nick said, there was a couple of slides back for those of you who are new joining. Usually around summer is when we submit and have our budgets approved in advance so it helps us to kind of know by May what those needs will be.
Absolutely. Thank you, Cynthia. Are there any additional questions?
There's one. Are you going to read it, Cynthia? You can, or I can.
Yeah, Abby, you can go ahead.
Okay, it's from Eliza. And are there particular issues y'all are focusing on for young people this coming year?
So anything that falls directly with our CHNA, we try to extend to youth as well. So anything that, again, relates to cancer, maternal child health, education, is something that was definitely interest of Baptist. And Cynthia or any other member from the team may be able to chime in as well on that.
Yeah, I would say the same. It's not that we're necessarily focusing on youth. In terms of like the age group, I think all age groups. So really, we're more so concerned about programs that are addressing communities that are underserved and underrepresented, and also creating access and building equity. So those are probably more the primary. And of course, when you think about our youth, there are certainly some needs that are specific to that particular demographic than maybe others, if that makes sense. Let me know if that answers your question.
Great point. And I would like to just add in, there are some programs that we do work with community partners. Like this Saturday, we'll have our Black Men in White Coats. And though it's not limited to just Black males, we've opened it up. We know that there's a health disparity amongst those going into any of the white coat professions. And so in order to increase health outcomes, we have to inspire our youth to think about programs that do involve STEM, and even looking at it at an earlier age. So this will be our third year doing it and partnering with other groups. And we went down to 6th grade and up. I think even the focus with mental health and our youth, we've collaborated with different groups to, how do we have those talk sessions and then partner with those experts to make sure that they have avenues for talking and addressing needs that are needed in their area. So we're open to programs that help with things in the community that really need to be addressed.
Absolutely.
Perfectly said, Marie. I've gotten hip now, and I'm able to see some of the questions in the chat on my phone, and we have one from Rhonda. Can you give an example of Baptist in-kind? Great question. A lot of our in-kind support comes in the form of healthcare professionals, dietitians, physicians that we have go into the community for speaking lectures, workshops. It kind of just runs the gamut of things that we're able to do with some of our physicians here at Baptist. We've partnered, we've given in-kind support materials as well, the things that we may have internal. We've also provided healthcare resources such as pamphlets, sometimes blood pressure cuffs, just to kind of give a high level example. And then I think Anne Marie may have some great examples of how we support in kind as well.
Right. You did a great job, Nick. And one thing that I'll just add is many of the people on our team have a wealth of expertise as well as team members at Baptist. And so usually there may be organizations that need assistance in some way, and we're able to leverage the expertise of those that work at Baptist to help in different endeavors. So one of my big things is looking at big events. How do we make it a win-win for everybody, and looking at the partners? And so a lot of times I'll sit on different committees just to help strategize to make sure that the outcomes are there. And so that's kind of an in-kind expertise. Sometimes you need a financial expertise as a board member or something like that. Those are also things that you can submit to us.
Perfect.
Right.
Thank you, Anthony.
Let me
Mike,
catch, so there's somebody who has a hand up, but let me answer these real quick if you don't mind. Donna asked also, was there one grant cycle? Yes, annually, but if you'll see, I think you had a slide on this, Nick, and you'll send out the slide afterwards. But there
Yeah.
are some times that you have events that you may not know about, that come up. So there is a time frame. We ask you like to give us 6 to 8 weeks if you could for speaker engagements. And there's another request for in-kind like 4 to 6 weeks. So you'll see that there are options available. But generally, we try to get as much as we can within that January through May time frame. And let me know, Nick, if you want to add anything else to that. But there's someone who has their hand up. Is it Tracy? Let's take that one before we go back to the
I think
chat.
it's Elise Davis.
Okay.
This is Tracy.
Thank you. This is Elise Davis. So I have twofold question. Is it possible to make a request for in-kind and also the charitable giving, or should we only focus on one?
No, it's
absolutely.
okay to do both. Oh, I'm sorry. Go ahead, Nick.
No, you're fine, Cynthia. We're saying the same thing. It's definitely okay to submit for in-kind and a charitable contribution as well. We don't have any limits on the number of requests you put in per funding application.
Okay, great. And then my second question, you touched on earlier how it depends if the question about what the limit is or a guideline for the amount to request in a charitable giving application. But do you guys have a rule of thumb? Considering the overall programming budget, is there a certain percentage that you don't want to exceed that?
We don't normally cap at a percentage, but I will say our giving normally ranges from like 5,000 to up to 10,000. I mean, we do give greater grant amounts depending on the organization and the need that's being addressed. But to just answer, I hope I answered your question directly, but there's no like funding cap. It just depends on your need.
Thank you.
And again, I'm sorry if I'm not getting to people's hand being raised virtually. I can't see that. So thank you, Cynthia and team, for
No,
jumping.
yeah, I think you did good. And the only other question I think that was right around that same time was Mike, with the Crisis Center, who we worked with for several years as well. Another creative way that we've been able to help them with a Google grant that they've done for several years. I think our investment has been about $4,000 a year, but it gives them, is it close to 100,000, I think, Mike, in terms of Google advertising investment to help people be able to better access support when they're in need of crisis?
Yeah, it's 120,000, up to 120,000 a year that grant leverages through Google. Yes.
Yeah. So that's just a great example how, Crisis Center got really creative. It's only 4,000 out of our budget, but the impact in terms of people being able to access the support is huge. Your question though, Mike, about the priority change, I think you kind of came in a little late and that was fine. But yeah, the current CHNA is 2019 that's posted on our website. And then we're required by the end of our fiscal year, which is September 30th by midnight, to have the 2022 reports available online. And so the priorities are still somewhat similar. What we're still seeing is an increase in mental health, which is no surprise to many of you on this call. So certainly if there are any, programs and projects that you're doing to address mental health support, we're absolutely interested in those. And you'll have the 2022 status, but we know that we're also building not only on access, but building equity in our communities.
Absolutely, Mike. And if I can just add on to that, Cynthia, our funding priorities come directly from our community health CHNA, Mike. I think that was part of the question too, kind of where we derive our funding priorities. They come directly from the community health needs assessment, which is subject to change every 3 years as we update our CHNA.
Yeah. And the next question was from Cherie with another one of our good partners at Project Homeless Connect. Emery, could you speak to that? Because she was asking, does Project Homeless Connect fit into this program? Well, I know we've supported, and I can't remember what our support has been, Cherie, I'm sorry. Other than in-kind, we've showed up with the homeless van providing support at Project Homeless Connect. But at one point, I think when you guys first started with the county and presented, there was a sponsored level. Emery, can you speak to that?
I can. I did put that in the chat, back to Cherie. And so we have participated, whether we've been a part of the planning, because it is a huge undertaking to bring all those partners together in coordination of healthcare, of social services, and all of that. And we've led the healthcare portion. In some years, we have been able to give dollars. It just needs to be put in the grant cycle early enough. So like if you're going to do something in 2022 fall, it needs to get in before May. And so that's the only thing, so that when we look at budgets during the summertime, then we can make sure that we've got allocations, if we're able to do the financial piece and the help with the legwork and coordination piece.
Yeah, and the homeless clinic, Cherie, is about operations on our side, and in terms of our contributions, around 300,000 a year. But there are, with that being our signature cause, and even across our system, we support a number of other homeless initiatives, homeless healthcare initiatives. So absolutely, please do, as Anne Marie says, submit that.
Yeah, we're so thankful for that partnership. I can't even tell you how much. Yeah, we won't be doing this till 23. So would it be the time to apply in September? I mean, now for 2023?
You can apply now for 2023. We're accepting funding applications for that for the calendar year currently. You have at the end of May 31st.
Okay, thanks.
And Cherie, if you don't have all the details, that's okay, guys. You can submit. We'd like to at least capture and say, hey, we've got Project Homeless Connect coming up. We know we want to ask Baptists if they'll be able to consider this level of giving. And we can always have conversations. A lot of times we'll conduct, just so you know, we get the request January through May, but then that allows our team, we'll start sometimes meeting with people beginning in the summer all the way through the end of December, conducting site visits, scheduling meetings to kind of ask more questions if we have to. We've got a committee that we pull together, our community, request committee, and they usually would kind of help us make some of those decisions around early June, just for us to submit our budget to say, hey, we feel like we might need, this amount of money to support some causes that are really, going to be important in the coming year. So it just kind of gives us an idea, if you can kind of keep that in mind.
Okay, thank you so much.
Perfect. Thank you, Cynthia, for that piece. I think we have a few questions in the chat. I have one from Tracy around service areas and in-kind support. So I think we serve, our kind of footprint is split between Mississippi, Central and North Mississippi, Tennessee, West Tennessee, and Northeast Arkansas. I think we serve around 110 counties. I think 110 counties as well. And there is a kind of breakdown of that in the PowerPoint presentation that I'll be sending out as well to kind of help you understand a little bit better what service areas like, Tracy. And hopefully I addressed your question. If not, please feel free to come off mute and
I think I am off mute, Nicholas. Can you hear me?
Yeah, I can.
We serve 7 counties in Mississippi. Do we need a Baptist hospital or something Baptist related in that county to apply for that county? Or do we need to only apply for some event or in kind that's where Baptist is in a county?
You want me to answer that, Nick, or you?
You can jump on that one. I can start.
Go ahead.
Here. We encourage you to apply. We're never going to discourage an application. We do typically tend to work with organizations that are in our counties that we support or our Baptist facilities are in. But again, we encourage applications because, again, we're always growing and expanding. And I know Cynthia may want to add to that.
Yeah, the only other thing I was going to add is the cyber grant system is set up that we already automatically input those counties, the zip codes that we're targeting in terms of impact. And so if for some reason it wouldn't allow you to submit based on your zip code, then you would just need to reach out to us and see if we can make an exception. We do have the case where Nick and I are able to issue you and Caitlin a bypass code to submit if it's not allowing your proposal to come in. But that could be one of the reasons if you're in a zip code that's outside of the boundaries of what we consider to be that service market area. But it's pretty broad. I mean, wherever we have a Baptist community located, it also includes the surrounding counties.
Oh, okay, good to.
And if you look at the CHNA, I'm sorry, Tracy, look at the CHNA as well on our website. It lists all of our counties that we serve. So if you're in the Mississippi market, it'll list out all the counties that are included.
Okay, okay. And the in-kind, I caught the tail end of that, Nicholas. Did you say like rooms and things, if we needed a room and we were close to one of y'all's facilities, that was considered an in-kind, and would we just get with that local facility, or would we still need to go through y'all?
I didn't actually mention that, Tracy. It's a great point.
That is a good question.
You're correct. We do offer support in-kind support as rooms as well, or space. It may be a little different with the COVID. So just reach out to myself or Caitlin, so we can kind of lobby that with the or champion that with the organization that's close in your county, or the hospital close in your county.
Okay, thank you so much.
Add that for Baptist, a lot of folks seek to utilize our Baptist auditorium, which is located on the Memphis campus off Warner Grove. I can put in the chat the external request link for you to be able to request that space. And we do capture it as in-kind for community benefits, so that does help us. Now, if you're in an area and you know, contact the hospital, one of our marketing directors, and you want to reach out to them, that's certainly fine. You have to reach out to, Nick or Caitlin if you know who to call, because the hospitals will make those decisions themselves. But we're happy to help you. Like Nick said, we're just, here to support and provide help however we can.
Thanks, Cynthia. I see another question here from GT. Does Baptist help college graduates find human resource to get into medical school? Through our programming, yes, GT, we do help college graduates. We don't have an internal program to Baptist that does that, but we have plenty of community resources that we can share that do this exact thing. And Anne-Marie, who actually works hand in hand with a lot of our graduate school initiatives, may want to chime in on this as well.
Right. You'll see more from Baptist University through their Health Core program, where they're connecting with people in the community, and they really will sit down and talk with different professionals as well as younger students to see where they are in their goals to aspire for a white coat profession. And so they will partner and kind of set up some mentoring for folks that are needing some. I have a daughter who's been out of college, but yet decided to go into medical field after her father passed, and not being in a university setting, but yet having an undergraduate degree, she needed somebody to help guide her and give her some information. And so she was able to connect with a professor at Baptist University to kind of have that support and where to go and where to look at advancing what she wanted to do.
There's a question in the chat on down. It's from Margot. I work with First Tee, and we work with children in using golf to teach life skills and core values. Should we submit to separate program requests, one for mental health and one for health, living, and education, or one request for both initiatives?
Great question from Margot. We try to condense our program requests, so there's a way you can submit as one. It'll be very preferred on our end. And again, like Cynthia touched on, after grant requests are received, we then reach out and kind of ask additional questions or may schedule site visits to kind of get any outlier questions that we may have. But if you can submit as one application, we encourage you to do that.
Yeah, and I will say that one that she's talking about might be a little difficult to have bundled in one. It just depends. To Nick's point, if you can do one, it'd be great. But if it seems like they're kind of separate requests, then they probably should be submitted separately. And then also, Nick and I, we're available, the team, if you start with Nick and me, to have some conversation before you submit if you need to. I love the idea that Nick had to put this presentation together, because we really haven't done it like this before. I was like, why wasn't I that brilliant all these years? But it helped us have the same conversation with 80-some people today versus have 80-something phone calls and meetings. And I've really been working myself hard all these years. So thank God for Nick. So but it helps us have this conversation, hopefully to address some of those questions and have reduced the number of meetings. But yeah, absolutely. We're happy to have some conversations around what works best with that one. Nick might even just want to kind of talk about it before what you're thinking about.
Yeah, I agree completely. And like to
Yes, it's Margot.
Yeah, go ahead, Margo. I'm sorry.
I was going to say, because our programs, it really kind of goes hand in hand. The whole curriculum of First T is to create healthy children, to be productive adults and young people in the community. So our programming and our curriculum of our whole program promotes all those things. But I'll put something together and get with you, Nick, and then you can tell me if I'm going down the right road or need to take a fork.
And, you know, it's actually refreshing, Margo, that you're talking about the programs, because I know with First T in particular, a lot of times it has been kind of event sponsorship requests that we've received. And so I didn't even realize that you were doing things around mental health and stuff. So definitely my interest is piqued here. I wanted to add too, because you made me think about something that I don't know if we shared, Nick and team, but some of you guys, even though we try to shy away from the events, the whole purpose is that it is because we're using charitable dollars to support these community programs. We're not using marketing and advertising. And so I think it's important for you guys to realize that some companies have, marketing advertising budgets, and that's what they gear their funding towards. We're a healthcare organization, so our marketing and advertising team will probably direct theirs to more marketing of services. We have a new robotic, surgical equipment or a cancer tool that's, something that's new in the industry and nobody else is using it. Those types of things, they'll probably, focus more on. But when it comes to community stuff, so let's say if we did a partnership with you guys on a program and you have an annual event every year, that's your signature event, we would love that as a benefit of partnering with you on a program, that you would just say, hey, we'll still list you Baptist as a partner with us at our signature event, whatever that may be. It could be a minimal listing, doesn't, really make a difference to us, but just still demonstrating to folks in the community that we're still working with you guys. And, if there's an opportunity to include like a table or tickets to the event, we're still interested in it. But the core of what we want to do is really make sure that we're, directing and investing in those programs with specific outcomes.
Thanks, Cynthia, for that. I think that's a great way to kind of structure your potential grant proposals, making sure that we're able to really have a good investment in the community from a programmatic stance, but also, again, wanting to be recognized throughout the community through your events and galas and things of that nature. So that's a great way to structure, Cynthia. Are there any more questions, or is there anything I missed in the chat? Let's see. Can we submit more than one proposal? Absolutely, Ariana. I will add a little bit more to that. You can submit more than one proposal. I will through our funding application. So if you have an in-kind support and a charitable giving need, I encourage you to do that. But if you are submitting multiple proposals under the same funding application, just give me a call and set up some time to talk through it, because there may be an opportunity where you can condense it to one application, or it just may need to be split in two.
And we don't want to miss any of them. And sometimes you may submit something and it's got various dates on it. So it does help if you can just kind of in the submission, give a heads up with an email, because there's some things that may be in kind that, you're looking at health, hypertension. What do kids need to know about hypertension? And, it might be on the golf course, all the safety things under the sun and staying hydrated and having that kind of talk. That might be an in-kind piece where we get an expert to come out and talk on that.
Perfect. Thanks,
And
Anne-Marie.
and that was one of those things that you said, if we have at least 8 weeks leadway, we can coordinate things like that. So that's those things that kind of pop up that we can put into our programming.
Absolutely.
Yeah.
I don't see this as a question, but I just kind of want to double down on submitting an itemized program specific budget.
Okay. Please.
A lot of times we receive these huge organization budgets that are not needed, because we see a good capture of your financials with the audit that we ask for in our grant request. So submitting a specific program budget a lot of times allows our team to look at the itemized line items and say, well, this program is great, but maybe they need a little bit more in supplies. So when we can see the full picture of a program, it actually may increase your chance of being fully funded. Or we may go back to the team and say, this is a program that's doing great work in the community and didn't ask for as much as they truly need. And having that itemized budget helps us assess the true value of the program.
Absolutely. It just, and then sometimes too, Nick, I'm glad you brought that up because we didn't think about that. The reason why the program budget, because like you said, we asked for your audited financials and all of that, but where there's a specific area that it says about your program budget, that's where a lot of times you'll look at our giving, the charitable giving guidelines, and I think Abby already put the link up when you go on to submit your application. So you'll look at the guidelines. There'll be an eligibility quiz that you kind of go through. It may ask you 7 questions. But one of the things they'll state is that, like, we don't support capital campaigns typically. There are some huge community initiatives, that we've done. Very few that we have a different conversation about. They may not necessarily be submitted through this portal because they may involve leaderships, decisions and so forth. I know we've done some significant things at Shelby Farms. Also, you guys are probably excited about the things that are going on at the riverfront. I hate to just be talking about Memphis Metro, but a lot of what we've done is kind of focused there that I'm more, more familiar with, because some of the entities, make those entity decisions, and we do have some things that we've done collaborated together, but for the most part, they maintain their own budget. But I just wanted to, let you guys know that program budget, sometimes people will include things in like staff costs, expenses, program materials and things like that. And that, again, like to Nick's point, helps us kind of delineate what would be appropriate for Baptist dollars versus you guys, maybe seeking other sponsors. And the reason we don't do a lot around, overhead expenses, staff costs, or salaries and things like that is because, like Nick said earlier, we don't know our budget year to year, and we would really hate for an organization to be dependent on funding from Baptist and hire staff one year and then have to let people go the next year because we weren't able to continue that sponsorship. So just kind of keep that in mind. Thank you.
Perfectly said, Cynthia. Thank you for that. I'm just scanning this chat to make sure I addressed every question. And again, feel free to come off mute if you have a question.
Yeah, and I saw a few people leave. I just wanted to make sure everybody on the phone does hear that many of you on the call have been partners with Baptist for many years. And that's one of the things I think that I hope we've done a really good job with, was really kind of establishing relationships with you guys. And for those of you who don't have a relationship, we definitely want to do that. So for the most part, people who we give to, we kind of know, we know their work, we know the value and their investments in the community, the impact and the difference that you guys make. And so we really applaud and want to support your work as best we can.
All right, I think we have addressed all the questions, and I don't see anyone unmuting. So I'm going to give you guys a few minutes back in your day. Thank you all for the great work that you do throughout all of our communities. Continue to be the light and continue to do the hard work. So thank you again for attending, and have a great rest of your day.